Okay, hello ladies and gentlemen, welcome to another new video on my channel, and this video is going to be on antiviral agents. So let's begin with the video. Okay, I've used some animation this time, a little more than previously. So let's begin with the video on antiviral agents. Okay, and I would like to tell, I will not discuss any points that I don't feel are important. I'll just discuss the points that I feel are very frequently tested on vignettes and questions on USMLE. So these are the points that are a must know for you. You can go into more details, you can know about more stuff, but these are the points which I think you are a must know. You can afford to miss these points at least. So let's begin with the video on antiviral agents. Okay, ta-da! So this is a cell and this is a viral particle. So let's see how a viral particle acts when it approaches a cell. What are the stages it goes through, and what are the checkpoints we can intervene and hit with our drugs. So let's begin. First of all is adsorption. So the viral particle has to be adsorbed and it should penetrate the cell, and then after penetrating it has to uncoat its cover envelope, and it has to release the viral mRNA and DNA, whatever is inside. And then after that there's early protein synthesis, then there is nucleic acid synthesis of the viral particles, and then there is late protein synthesis and processing. The viral mRNA or viral DNA encodes or orders the cell machinery to make the proteins for daughter virions, and then there is packaging and assembly of the virions, and then finally there is a release of the viral particles to infect new host cells. So these are the stages or the checkpoints the viral particle goes through after entering the cell and finally releasing out of the cell to infect other new host cells. So, and these the red labels are marked. These are the checkpoints where we can hit them with our drugs. So we can hit adsorption, we can prevent the viral particle from uncoating itself, so it does not release the damaging its own coding sequences for our cells. And then we can block nucleic acid synthesis of the viral particles, and then we can prevent the late protein processing, and we can prevent packaging assembly, and finally we can prevent release. So let's see how do we do that. Okay, so here, as you can see, these are the checkpoints and these are the drugs. So let's see, first one is enfuvirtide. This is the drug that prevents the adsorption of the viral particle, and I'll discuss its details in next slide. And then amantadine, this drug can prevent the uncoating of the viral particles. And then reverse transcriptase inhibitors, as you know, as the name says, they inhibit the enzyme reverse transcriptase. So obviously they will prevent the synthesis of DNA from mRNA, or they prevent the synthesis of DNA from RNA. And then protease inhibitors, they will prevent the processing of the proteins synthesized by the viral DNA, and they're particularly useful in HIV infections, but of no use in influenza. Why? That I'll tell you in another slide. And next is rifampin. This prevents the packaging and assembly. And finally are neuraminidase inhibitors. They prevent the release of virus particles, very useful in influenza A and B. Like drugs like oseltamivir, zanamivir belong to this category. So enfuvirtide, amantadine, RTIs, these can include NRTIs, NNRTIs, protease inhibitors, rifampin, and neuraminidase inhibitors. So let's see them one by one. But before that, I would like to see two things. One, you can see this mnemonic on the side, earpin. This is also in accordance with the order of the drugs. You can see E is for enfuvirtide, A for amantadine, R is for RTIs and rifampin both, P is for protease inhibitors, and N is for neuraminidase inhibitors. So this is for earpin. Okay. Also, I would like to tell one more interesting fact about amantadine, that it is an anti-Parkinsonian drug also. So amantadine is an antiviral drug that is also used in Parkinson's disease because it not only increases the release of dopamine from dopaminergic neurons, but also it prevents the reuptake of dopamine into those neurons. So it's a good anti-Parkinsonian drug, and it's a good antiviral drug, especially you can find vignettes on this. Okay, so let's move on to the next slide and discuss all of them one by one. Okay, non-nucleoside reverse transcriptase inhibitors. So reverse transcriptase inhibitors, enzymes which inhibit reverse transcriptase, or drugs that inhibit reverse transcriptase, belong to two categories: non-nucleoside and nucleoside. So let's begin with NNRTIs, or non-nucleoside reverse transcriptase inhibitors. Okay, so about NNRTIs, I'll just show you in an animation. Okay, as you can see, non-nucleoside require no intracellular phosphorylation. This is the most important thing. So this is the basic bottom line difference between NNRTIs and NRTIs. It's that NNRTIs do not require any phosphorylation or activation inside the cell to act, so they just go and act, while NRTIs require to be first of all converted into a triphosphate active form to act. Okay. Next are two N's. Non-nucleoside, no intracellular phosphorylation, nevirapine, most frequently asked drug, and NAD is the mnemonic for these three: nevirapine, efavirenz, delavirdin. You can remember DEN too. So okay, important points about these that you will encounter in questions or MCQs is that NNRTIs are frequently associated with severe side effects. First of them is life-threatening hepatic failure and encephalopathy. They can cause severe hepatic failure, which can cause encephalopathy, obviously, because ammonia gets accumulated. And secondly, they can cause severe skin reactions like Stevens-Johnson's necrolysis and toxic epidermal necrolysis, as you can see in the slide. So these are 3 or 4 points that you must keep in mind about NNRTIs: are no intracellular phosphorylation for activation, nevirapine, and severe hepatic failure and skin reactions can occur with these drugs. Okay, also I would like to add one more point here. Nevirapine is a good drug used frequently for the prophylaxis in pregnant mothers to prevent the transmission of HIV from mother to the child. So nevirapine has a use in that too, and that is also sometimes tested. So you can remember these points about NNRTIs: nevirapine in prevention of HIV transmission from mother to child, and severe side effects of these drugs, hepatic failure and skin reactions, and they do not require any phosphorylation. So this is all about NNRTIs that you must know. And next is we'll go to NRTIs. Okay, so I think you're happy about this. Okay, so these are NRTIs, or nucleoside reverse transcriptase inhibitors. Okay, these include zidovudine or AZD, zalcitabine, and didanosine. So we can go into as much details as we want to, but this is a short video on the points that are, as I said, most frequently tested, or the points that are a must know, and you can't afford to miss these points at least. So let's see those 2 or 3 points that I have compiled for you guys. So okay, first of all, yeah, as I said, they require phosphorylation, and that's the bottom line difference between them. NRTIs require phosphorylation to become active, and non-nucleoside reverse transcriptase inhibitors do not require any phosphorylation. No phosphorylation. Okay, so they require phosphorylation. Phosphorylation, also I would like to add on an extra point, if you would like to know, is that they get converted into an active triphosphate form, and that is true. First phosphorylation, or the monophosphate form, is formed through the viral kinase enzyme, and the triphosphate form is later on formed by the host cell kinase enzymes. So if you would like to know, anyhow, That's how the phosphorylation happens, and then they become active. So I'd like to share some important side effects that are tested in vinets. First is zidovudine. Yeah, I hope you liked it. Okay, so bone marrow suppression. Zidovudine is notoriously very commonly related to bone marrow suppression, and it can lead to anemias and granulocytopenias, obviously. So they may give you a question where their patient has anemia, granulocytopenia, pancytopenia, and they can ask you what kind of a drug can the patient be on. So if it seems like he is having some kind of infection or he's an HIV positive patient, okay, it's zidovudine. Okay, and okay, sorry for that pause because I was just checking something else. Anyhow, so bone marrow suppression is commonly related to zidovudine, but there is one more drug that is related to bone marrow suppression, and that is ganciclovir. So I'll come to ganciclovir later in some next slide, but the point is that you are not supposed to give zidovudine and ganciclovir together, because together with their synergistic effect they can lead to a severe bone marrow suppression and pancytopenia. So be careful about that. Anyhow, so zidovudine and NRTI, nucleoside reverse transcriptase inhibitor, requires phosphorylation to become active, and bone marrow suppression is the side effect. Next is an important side effect of didanosine, and that is pancreatitis. Didanosine is commonly associated with pancreatitis. So you see a vinet on pancreatitis and antiviral drugs are what you are thinking, you can go for didanosine. And if you have side effects of bone marrow suppression given, then you can go for zidovudine or ganciclovir. That will come later on. That will come to it after a while. Okay, so I hope you're happy to know about these drugs. Again, I'm showing you the main page. Enfubertide, amantadine, RTIs, protease inhibitors, rifampin, and neuraminidase inhibitors, erpin. So let's go to our next slide on protease inhibitors. Okay, I guess I need to work better with the animation stuff so that it goes. Okay, so protease inhibitors, ritonavir, saquinavir. These are the protease inhibitors. Now what do protease inhibitors do? Okay, so what happens is that some virus particles, before making virion particles, make a long polyprotein inside the cell. So like in HIV, first of all, a long polyprotein is synthesized, and then that long polyprotein is cleaved or broken into smaller parts by proteases, and those smaller proteins are then packaged and assembled, and ultimately they lead to the formation of mature virus particles. So they help in cleaving those polyproteins that are synthesized in the earlier stages of viral replication. So if we give an inhibitor for these proteases, the polyprotein cannot cleave, and obviously processing of the proteins cannot occur, and ultimately the maturation and assembly cannot occur, and the viral replication stops. So that is why we give protease inhibitors. So let's discuss them in more detail. Yeah, as I said, prevent the assembly and maturation of the virus, and non-functional or non-infectious virions are produced, and the processing of the proteins cannot occur. Bottom line is that. Okay, the second point is they're useful in HIV, as I said, because HIV produces a polyprotein, and which is cleaved with the proteases, and these protease inhibitors prevent the cleavage. But they're of no use in influenza, because in influenza the proteins are already formed in smaller segments and they do not require cleavage, so there is no use of protease, and so no use of protease inhibitors. So that's the bottom line about these drugs, that they are useful in HIV but of no use in influenza. Okay, so there's a small animation I'm gonna show you. Okay, this is the polyprotein, and these are proteases, and they cleave this polyprotein, leading to formation of smaller processed proteins, which are ultimately assembled and matured, and they lead to formation of finally the mature virion particle. So this is what is the function of proteases, and this is what protease inhibitors do. They prevent the function of proteases. And as in influenza, there are no proteases are required, and there is no use of proteases in influenza, so no use of these drugs in influenza. Okay, next one is neuraminidase inhibitors. A long paragraph you can go through by pausing the video, but bottom line is these drugs help in release of virus particles out of the cell. First of all, they will I mean it's a type of let me see, these drugs bind to sialic acid residues on the host cell surface and cleave those sialic acid residues, and then finally help in the release of virion particles out of the cell. So that's the main function of these drugs. Oseltamivir is the commonly tested one, and also you can find zanamivir in some questions, but mainly oseltamivir, also called Tamiflu, and it is useful in both influenza A and B. Can be used for both prevention and treatment of influenza A and B. Okay, some other points about antiviral agents. Interferon alpha and beta. These are not drugs but interferons. So these prevent the viral protein synthesis by increasing the by I think I screwed up a bit. They decrease the production and increase the degradation of foreign viral mRNA. So you can reverse these errors. They destroy the foreign mRNA and they have no effect on the host mRNA. So next is ganciclovir. As I was discussing, ganciclovir also causes bone marrow suppression. It inhibits the host cell DNA synthesis and leads to neutropenia, anemia, and thrombocytopenia. So never give this with zidovudine. Okay, another important point about ganciclovir is that it is used in CMV infections. So if you see a minute on CMV infection and the drug is asked, you can just click on ganciclovir. So the two important points about this is this drug would be related to CMV infections, and it causes pancytopenia similar to zidovudine and should not be given with zidovudine. Also, yeah, remember one more drug can be given for CMV infections, and that is foscarnet. Foscarnet inhibits DNA polymerase, and it's a pyrophosphate analog, and it can also be given for CMV infections, but mainly ganciclovir is used. So remember this ganciclovir, CMV infections, and pancytopenia. Next one is influvirtide, which we discussed in the beginning of this presentation. It prevents the fusion GP41 fusion protein. It binds to that protein and it inhibits the infusion of the virus particle inside the cell. So bottom line, it prevents the entry of the virus into the cell. So that is why it's important. So I'll just take you to the first slide. I have not done much good animation, I guess. Okay, so here we are. So neuraminidase inhibitors preventing release, protease inhibitors, RTIs, amantadine, influvirtide, have discussed all of this. Let's you can remember the order. Let's go to final slide again. Ganciclovir with CMV and pancytopenia, and influvirtide prevents the entry of the virus into the cell. Okay, this is laraltegravir, another new drug I thought of discussing. That is an integrase inhibitor, and it prevents the attachment of viral DNA to host DNA. So that's the main purpose of laraltegravir. That is to prevent the fusion of viral DNA to host DNA. So guys, that was it about antiviral agents that I thought you must know. So that's it, and I hope you found this information useful. So there could be much more details you can go into, but these are the points that, as I said, are a must know, and you'll encounter them again and again when you solve MCQs. So just keep these things in mind about antiviral agents, about ganciclovir, about enfuvirtide, about raltegravir, about all the drugs I discussed. So I hope you liked it, and this was almost about it. So it's over, and I hope I gave you smiles from this video. So next time I'll see you in a new video on some new topic, and till then, if you are new to my channel and if you want to stay connected with all the videos I share, then do click on the big subscribe button you can see on the screen now, or you can click on the subscribe button given below this video, and